Sarah Luck is a 56-year-old female who presents to the clinic today with low back pain and frequency with urination. The patient does not appear to be in any acute distress at this time. Her medical history includes kidney stones and iron deficiency anemia, and she takes over-the-counter iron supplements for her iron deficiency anemia. She also is allergic to penicillin. Her surgical history includes lithotripsy in both 2015 and 2017. She had a gastric bypass surgery in 2013 and a hysterectomy in 2006. She denies drug, alcohol, or recreational drug use, and her family history includes her father who had diabetes and her mother who had pancreatic cancer. The patient is afebrile at this time, has a blood pressure of 150/80, a pulse of 62, and oxygen of 98%. The patient denies any chest pain, shortness of breathing, wheezing, or dyspnea. She denies any nausea, vomiting, or abdominal pain, but does have pain with urination and frequent urination, and also complains of lower left back pain, but does not have any leg weakness and has not had a recent fall. On GI exam, it was unremarkable. There was no CVA tenderness and no tenderness to palpation or deep palpation or light palpation. On musculoskeletal exam, the patient had left paraspinal muscle tenderness and spasm, obvious spasm, with a normal range of motion and a negative bilateral straight leg test. The patient's cardiology exam was unremarkable. There were no thrills, no rubs, no obvious murmurs, and no edema. The patient's lung sounds were unremarkable. There were no wheezes, no crackles, no rhonchi. After the review of systems and the history with this patient and the exams, we decided to get a UA, and the UA revealed dark urine with +1 leukocytes. So at this point, I would likely assume that there are two different diagnoses for this patient, just due to the fact that you can see obvious spasms on musculoskeletal exam. I would assume that this patient is experiencing a muscle strain. I would assume that it would be a muscle strain because it is reproducible and you see obvious muscle spasm. Two other differential diagnoses for this issue could also be degenerative disc disease and back sprains, which we do see in patients her age. And then additionally, for her urinary pain with urination and her urinary frequency, that's likely due to a urinary tract infection. This is likely because of the dark urine and the +1 leukocytes and the pain with urination and frequent urination. Other differential diagnosis for this issue would be a STI, a sexually transmitted infection, or a kidney infection. Likely it is not a kidney infection because there is no CVA tenderness and no pain on an abdominal exam. Likely my plan for this patient would be to prescribe an antibiotic and a muscle relaxant, so trimethoprim and sulfamethoxazole, and cyclobenzaprine, the muscle relaxant Flexeril for her back spasms and muscle strain.